Hello everybody. Thank you. As Jane said, my name is Dianne. I'm a midwife, still practising. I now work in a private hospital in delivery suite, but I also work for Health Direct Australia, looking after our pregnancy, birth and baby service, which I'm very excited to talk about, an innovation that we have ventured into social media. Prior to starting though, I'd like to acknowledge the Palawa people, who are the traditional custodians of this land, and I'd also like to pay my respect to the elders past and present, and extend my respect to other Aboriginal people who are here today. I'd also like to give a big shout out to all my fellow midwives on International Midwives Day. Yay! So I feel very excited to present on this day. Oops, I'm going to press the slides. That's just a quick slide about Health Direct Australia and who we are. We are funded by all the governments and states and territories. You might see your government or state or territory logo there. We do have a booth in the exhibition area, so if you want to know more about Health Direct Australia, come and see me there. So what is Pregnancy, Birth and Baby? That is the service that I want to talk to you about today. Pregnancy, Birth and Baby began in 2010. It was an initiative out of the National Maternity Services Plan. We provide support and information to expecting and new parents with their child aged up to 5. And the whole purpose of PBB Pregnancy, Birth and Baby, is to support parents to make informed decisions around their care during pregnancy and the care of their child. It's currently staffed by maternal child health nurses who are also midwives and counsellors, and it operates 7 days a week from 7 a.m. till midnight via phone, website video and Facebook, which I'm going to talk about today. And our staff obviously are very knowledgeable and experienced with child and family health issues and supporting parents. And it's funded, the entire service is funded by the Commonwealth Department of Health, so it's a national service for all Australians anywhere in the country. So, hang on. Can't remember, my paper doesn't turn that. Okay, so who uses Pregnancy, Birth and Baby? In 2014, the average age for giving birth for women, obviously for women, was 30.2 years. We don't have an average age for men yet, but one day maybe they'll figure that out. And for Indigenous mums, it was 25.5 years. And that age matches very closely to the age of our caller profile. So the majority of our callers are aged 26 to 35. 22% of mums are over 35, and the average age of the first-time mum is still under 30, even though people may think it's over, is 28.7 years. The demographic of our caller profile is predominantly female, so pregnant women and mums, 77%, but we have 10% of dads calling our service, and obviously grandparents and other interested parties ring us as well. So anyone can call the service, it's not just for mums, but mums engaged mostly. So how do our users use Pregnancy, Birth and Baby, and why social media? You'll see from the pie graph up there that predominantly, so a little over 80% of our users are either on a mobile phone or a tablet. So they're very mobile device. Oh, thanks, Emma. I can turn my page and I think it's turning up there, sorry. Very technically aware am I. Sorry. Right, if I hold that in my hand, I'll be right. So, sorry, so on the blue pie graph, close to 77% are on a mobile device. Another 6% are using a tablet. Very few are on desktop, so which is the way of the world. You just have to look around you. People have their device in their hand. And 80% of pregnant women aged 20 to 35 are online. It's where they are, it's where they live. And our audience is very social media literate. They're digitally engaged, and they have a real appetite for a multi-channel access approach to services, and not just one way. They want to be able to choose and lead the way they access services. So what does our Pregnancy, Birth and Baby Facebook community look like? Very, very similar to our phone community. In the age group 26 to 35, it's the same percentage. 19 to 25-year-olds, it's 13%. So they're not just online on their phone, they're then transferring on to Ring using the same phone. So it's the device in their hand is how they're operating. Interesting though, the gender profile is different, so our Facebook community is predominantly female, 95%, and only 4% of men, whereas there's 10% of men are using the phone. So their partners are finding stuff online and putting it in front of them, to the men. Now, hoping that you can read. Oh, you can. There you go. The towns. So with Facebook, you can get a whole bunch of information from Facebook. And if people actually allocate their city or town location, then you can see where they are coming from and engaging with you. So obviously, predominantly the metropolitan areas are high, but that's because of higher population. But, you know, there's places like my old hometown, Wagga Wagga, is on there. There's Dobbo, there's Ipswich, and there's, a bunch of towns. So it's really quite spread. So what is a Facebook forum? So in a nutshell, it goes for an hour. It's using, it's a live chat session. So I'm just checking not to turn the page. Sorry. A live chat session, it's interactive. It uses Facebook's comments section and doesn't require any other technology other than the fact that you have a Facebook page, and it has a specific topic focus. That's an example of one that we had, toilet training. So how does it work? Okay, so we begin with a pre-forum planned promotion period, and it uses the event page. And if you've ever used Facebook to organise a party or a birthday party, you might set up an event. It's exactly the same as what you do on your personal site. So we send out a save the date, using that 3 weeks before the date of our forum. 2 weeks before we send out the event invitation. And with this event page, our users can RSVP. If they RSVP, they then receive the reminder the day before. The reminder is still published on the event page, but it gets sent directly to people who RSVP. And if people have RSVP, then their friends see it, so it extends out the number of people who actually get to know about it. The other thing that we use the event page for is to invite people to post their questions that they like answered by the nurses. And so we can then use those to pre-prepare a little. Now, on the day, yes, on the day, so this is just on the far side is a screenshot of some question and answers and what it actually looks like. It's kind of similar, it's very much the same. We use then the comment section on the page. So the nurses are available to answer those questions on that time, on that set topic. Users post their question and then the nurses respond. We have moderators who are also watching what's going on to ensure that the discussion remains on topic, to also respond back, because often we'll get thanks, that was great, it was really helpful, just to keep an eye while the nurses are actually writing the answers. We're watching what goes on. If there's topic becomes off topic, if the question, becomes off topic, we have set answers so that we can direct people to where to get that information. And also, if anything is posted that's not really appropriate, then the moderators deal with that as well. It can become quite frenetic, so that group of us are quite busy for the hour that this is on, but it's also, in the words of our nurses, rather exciting and fun. All right, so what is it? This is the one thing that everybody is so afraid of with social media, you know, the dangers, what will happen, what about the trolls and the people wanting to attack you. And we at Health Direct, because we're government funded, take a fairly low risk level, so we do significant risk management stuff. So we had everyone in the room, including the lawyers, and so kind of, what could go wrong. And, when you do that risk management stuff, you go to town on the what could go wrong. And we looked at, could we do them any harm, and could they do harm to each other? So that's obviously a significant concern, and you want to have risk mitigation strategies around that. What would we do if someone posted negative comments? How do you respond to that? We had our multi-channel lead in the room who's done lots of this stuff with other companies, and everyone has, we had health people in the room, legal people in the room, people who live in social media in the room. So everyone has a slightly different focus about how dangerous it really could be and how we should respond and what that world really is like. We ask the question, if we do this, will anyone actually turn up? Like, we'll be sitting there waiting for a question and nothing's happening. And also that the timing is really important. Facebook is really fast and these people are used to really instant responses. Can we be quick enough to write what we need to write and get it out there, or is it going to take too long? So we had strategies around all of that. And then, so we asked the question, why would we even bother with Facebook forums to reach our parents? Currently, they can ring us through a phone number. 7 days a week. They're always there. They can video call in and see the nurses. We have a website with a host of information. The real thing that we wanted to know was, were they even interested in not just a real-time chat, but public chat? So with all of these other things, it's private, it's one-on-one. No one else is seeing the answer to your, not even seeing your question, let alone the answer to your question. So did they want that? Were they interested? And of course, you know, there's a whole bunch of us that are on Facebook, so perhaps they are. So we thought we'd do a pilot of 6. We've done a lot more than 6, so the pilot's kind of morphed into real-time activity. And, you know, we also wanted to know about the user behaviour, the workflow, some of the process stuff that we would need to know to roll this out, perhaps across all our other services. So this is what happened. So we've done 9 now. We found that there's been like a compounding effect, and you can see the coloured bars represent a different forum and a different topic, from the very first one to the last one, which was only on Wednesday. So only day before yesterday was our last topic, and that's the one that's doubled the engagement as well. So we find, and one of the things we've really found is that just doing this all the time, some consistency is really, really important, that people start to know that we're there and they're really engaging. Now, our topic choice, we chose topics, we started off very carefully, that we're going to go to topics that surely would not invite any kind of topics, responses, people getting, you know, worked up about what we say, you know, the trolling kind of stuff. So solids, well, I suppose you can argue that there's all sorts of issues that people can raise. We started with a very sort of selective age range with things as well and kept it fairly tight. But the last 4, we broadened it out. Things like surviving Christmas was around food while you're pregnant, food with your children, when you're travelling in the heat, that kind of stuff. And that really, we found that opening it out into the whole age range that is pregnancy, birth and baby really engaged a lot more with people. To our last one, which was on colds and flu, and I'm going to say the word, vaccinations on Facebook. Talking vaccinations on Facebook, and we survived the experience. Nothing bad happened. In fact, it was the most successful forum that we've run. So now, the other thing that we have discovered that Facebook have become a little money-centric. So if you don't spend any money, you know, they kind of hide you a little bit. So we found that by boosting is the word that it's called. It's great, boosting. But it's only, we spent $100 on the event page, and that got it boosting. So in other words, it got in front of more people in our age group who are either pregnant or parents. And you can tell by these bar charts here. So the blue ones are the consumers who actually saw the event page, and the little orange line are the people who RSVP'd. Now, I didn't get to update this for Wednesdays, it was 2 days ago, but from March, when we had 51 RSVPs, for Wednesday we had 162 people RSVP to the forum, which means it would have been seen by a whole bunch more. While the forum isn't run within the event page, it's the significant promotion tool. But it does, they get to see it, so they get to know about it. And you know from your Facebook page that things scroll. If you're on Facebook, it goes really fast through, and you can easily not know half the stuff that's going on. So this actually helps people get to see that an event is on. We found that in doing that, we had a 500% increase in reaching parents. And it's been hugely successful in building reach and engagement outside of the event. So we watch what's going on in that hour to see who's actually there and engaging with the forum, which is the orange line, the live, it's called reach, live reach. So it's actually the number of consumers who were seeing the discussion and involved, which was, I can't even read that now, here we go. So that was 1,000. And the total reach of consumers, so we monitor that for 48 hours or 2 days after the forum, was up to 6,000 at the end of September. I don't know what Wednesdays was, but I do know our live reach doubled as well to 2,000 people seeing what was going on in that 1 hour. Let me I've got my papers here. The other thing that we have discovered, thank you, is that using social media has increased the traffic that comes through to our website, which is then will increase traffic through to our phone service. So it brings people into where they can find more information. So this little chart up here is showing prior to the little stars of when we've had forums. So prior to the forums, the number of people who would have seen our posts on our Facebook page, very low numbers were coming through to the Pregnancy, Birth and Baby website, which incidentally has over 400 pages of content information that's clinically written for them. So very good information through pregnancy and parenting. And that has increased up to 25,000 following the Facebook forum. So what about outcomes and clinical safety? The world didn't end. We have had no negative comments or trolling or anything like that that we would even have to consider closing down. People find it's like the phone, it's instant and it's easy. And like the web, it's accessible on any device and they can share amongst each other. So it allows them to own the information and the service. So, can you do this too? So these are some of the things that we considered in our setup that is really prior to even putting the nurses into that position where they'll be writing responses. So there was training and practice, how to create event pages, who moderates comments, how to publish posts. So wonderful Ellie, who is our in-house genius on Facebook and social media, who's taught me heaps, went and taught the nurses how to do all of this. We spent a lot of time in considering how you would actually write the response. It's easy to talk to someone and give them an answer to a question and over the phone, but when someone asks you a question, you've got to write it. You want to craft it and you want to make it so that it flows better, but you also don't have a lot of time. So one of the things we do is we think about everything we might be asked and we pre-craft some questions and then we and then we can adjust those to the live questions that come in. And really think about who's going to do what. We have there's two nurses who are writing the answers, there's two moderator people in the room, I'm in the room from a clinical kind of oversight perspective. So people actually have a very active role. Didn't go. There we go. Think about your topics. So what's going to engage with your community and who are they and their ages and where they're at. And maybe even consider why you're doing this, what your outcome is. Do you have a health message you want to promote? Do you want to have just another way to engage with people? And have fun. Have fun. Our last forum on Wednesday was the most interactive that we've had, and the hour went like 5 minutes, and I thought, I know how our nurses have coped when it was the best fun they've ever had. So they really enjoyed it. So it is a lot of fun to be out there doing that. So that's the end of my session. Now I know that we're running heaps behind time, but like I said, we are in a booth out there, so if you want to come talk some more, if you want to have a look, I can show you. It wasn't game to do anything live internet, but if you want to, I can on the booth and show you what it actually looks like. Thank you very much. Oh, I did have that, but I don't think we have time. Thank you. Well, do we? Do we? Oh, yes. Hello. It's possible. It's possible that they don't know that the service exists. Sorry. Oh, yep. They want you to speak into a microphone.
Sorry, I was just wondering, Tamworth and Newcastle and New South Wales didn't get on your heat map of persons utilising the service, and I wondered if that was because of a lack of print media being disseminated at the Child and Family Health Clinic or through the hospital settings.
It could be a couple of things. So we have about 17,000 fans on the Pregnancy, Birth and Baby Facebook page, but only about 7,000 of them identify where they live. So people have to select that in Facebook and allow that to be public in their privacy setting things. So that could be partly. They could be there and they just have it. Don't want anyone to know that's where they are, or anyone to know where they are. But it could be that they haven't found us. or the page to become and to see it, that you're right, and haven't seen it come through on Facebook, and they may also not know. So I can, if that's where you're from, I can come and see me, and I'll give you a little flyer so you can we have promotional material, and that's free. So it's free shipping. There's no cost associated. So if it's a service you'd like to promote in your area, then we can easily get that information to you. Thank you.
Very good. Thank you.
Thank you.
Great.